doing things electronically is very different from doing it on paper. I'm the Associate Chief Nurse for the Spaulding Network, which is 6 different facilities, and I do a lot of sort of project work, so I go around to the different sites and, get involved with different things that are going on there. We don't want to just recreate the process we had on paper. We want it to be even better. We want to take advantage of everything that's in the system. So if we're making the changes, or a lot of times like the impetus for the change is, it doesn't look the way I'm used to it looking. I want it to look like very familiar. I want it to look like my paper med sheet. Well, that change isn't going to happen, and I think it just takes people a little while to get used to it and understand that it may even be better than what you're used to. The thing is, though, people are at different stages of implementation. So you can say, like here, again at Spaulding Boston, we have computerized provider order entry, CPOE, and where at Cambridge they don't. So the orders are entered differently. So you can really see the benefit of having the complete IT solution or the complete package. There was a lot of anxiety about, like, are we going to be able to deal with this? It's so different. Where are we going to jot our notes? There's a lot of this paper stuff. It's really holds you to a higher standard in terms of when the meds are given. There's no room for kind of fudging around. So there's a lot of anxiety about sort of going live. There are people that would be up at night with having nightmares, thinking, how am I going to give my medications, because it's so different, and they just, their mind fills in the blanks. There's IT people, there's clinical people, there's a steering committee that really kind of sets the tone for everything, and that's a high-level committee with John Campbell, who's our director of IS, and Joanne Fusil, who's my boss, the chief nursing officer, the director of nurses at the site. And then what we did, which I think was really amazing, and we did it in this setting here at Spaulding Boston as well as we're replicating it at Spaulding Cambridge, is we really involved the staff nurses who are the end users in the pharmacy, who are also, very involved. Tried to bring the end users in, not just have the steering committee sort of make some unilateral decisions that then couldn't be acted out on the clinical site. We really tried to anticipate what where we might fail in the process, and in doing that, we were able to avoid a lot of the potential failures. We couldn't do it without the super users. And the super users are really, some of them are nursing leadership, like, some of the nursing supervisors, or one is a nursing informaticist, which are really high-level super users. But a lot of the super users are really just people that are like 1 week ahead in training of the rest of the staff. It's someone that at least has that, has some background in their, locally based. So, I might be more apt to ask you a question if I work with you than someone that's, coming in from Cape Cod or Boston or something. I think one thing that we do very well at Spaulding is, we're a rehab facility. That's our kind of basic core business anyway, is rehab. So we're used to working in an interdisciplinary team, and I think the leadership in IT and in nursing and on the clinical services really try to work together. So having kind of the dialogue where we begin to understand each other has been very helpful, and helped, I think, ultimately in getting those things in place more solidly. We're getting a lot of messages now that we didn't have before on our paper system. That, this is really the way of the future and this kind of thing. And people really appreciate that. The patients appreciate it because, it is kind of a dangerous environment, the hospital. And plus the patients are, they're patients because they're in the hospital, but they're people too, and they want us to do well. Like, they understand this is important, and they, really try to help as well, I'd say.